Hello, everyone. I hope all are well and staying safe and positive. We are group number one, and we will be presenting information on wheelchair transfers for various diagnoses, as well as showing some demonstration videos of each transfer. Also, just a side note, due to the current circumstances we are all experiencing with staying isolated at home, and for the safety of everyone, some group members were unable to film demonstration videos outside their house or have access to appropriate DME. We will start with Miguel presenting on wheelchair transfers for CVA.
Hey guys, so for my portion of the PowerPoint, I'm going to be talking about how to do transfers going from the wheelchair to the floor on a CVA patient. I'm going to start with the general requirements. So for this particular patient, you want to make sure that the patient has sufficient strength and mobility on the unaffected side, on the upper and lower extremity. The first thing you want to do is make sure that you lock the wheelchair and remove the leg rest. And you want to do this to ensure that the chair doesn't move during the transfer and also that the leg rests don't get in the way when you're transferring the patient. You do want to make sure that you put a gait belt on the patient. Again, this is for safety purposes and to provide assistance. Next thing you want to do is stand next to the patient's weak side and then have the patient scoot forward as it shows in one of the pictures here in the PowerPoint. Once they do that, you're going to have the patient roll over into the strong side. So again, encourage the patient to do as much as they can on their own, but also provide assistance if they need it. Once they start rolling, make sure that you keep instructing or cueing the patient so they can start rolling into their elbow all the way into their stomach so they can be facing the wheelchair. As soon as the patient is facing the wheelchair, you're still going to be assisting that weak side. So you could be on the strong side at this point, but your hand will still be supporting the weak side as it shows in one of the pictures here on the PowerPoint. Um, so at this point, the patient will have their strong hand on the wheelchair. So have them bring it into the floor for support. And as soon as they do that, you can assist the patient into their back. And again, this is all depending on how much assistance the patient needs. And from here, you can have the patient either lay on their back and start with exercises or stretches depending on the patient's needs. As far as the application of these transfers go, they can either be done to do exercises in supine, stretches. In some cases, they can also be done for stair training on patients who need to scoot their way up to the second floor in a seated position. And it can also be done due to a medical emergency. Sometimes, cardiac blood pressure issues, something like that. Again, one thing to consider is that you will encounter patients needing different levels of assistance. Um, it can be someone who requires a lot of help, or it can be someone who doesn't need as much help. So if you don't feel comfortable doing this transfer, you can always get another person just to help you out. And if you still think that this transfer is not appropriate, then maybe try something else like an airplane transfer or even using a Hoyer lift. But again, that this is mostly for someone who has a good upper body and lower body strength unilaterally. Now, I'm gonna present you a video that I made that shows you this transfer technique. And one thing to keep in mind is that you can always modify this transfer according to your patient's needs, also according to their age and their medical diagnosis, if they have precautions and contraindications. So it doesn't have to be exactly the same way I do it. This is just the way I did it. How to do a transfer going from the wheelchair to the floor on a CVA patient. In this case, we're going to assume that the patient's weak side is the right. A few things to consider before doing the transfer is make sure that the wheelchair is locked. Make sure that you put a belt on the patient. Make sure that you remove the leg rest. And make sure that you stand on the weak side, in this case the right side. So first thing we're going to do, I'm going to have you scoot forward using your strong side. Put that leg out. I'm going to have you roll all the way into your tummy. You're going to be assisting the patient here. You're rolling. Go down. Good. Now you're going to have the patient bring the hand down. Good. Slowly go down. Make sure that you're keeping a straight spine. using good body mechanics. And then you're going to have the patient kick their leg out. Now from here you can have the patient lay down, do exercises in the mat, whatever you have to do with the patient. Pretty much it.
We want to make sure patients who have suffered from CVA have the proper knowledge to transfer from floor to their wheelchair or chair in case they do ever suffer from a fall. There are different ways to safely get back up, but all depend on the patient's strength and mobility. In this case, our patient has enough strength on their unaffected side to not need assistance. We want to be sure that our patient knows that if they do fall, to take a second to make sure they did not get injured before anyone assists or they go to get up. If they are okay, they can get themselves into a side sitting position, then lock both wheels on their wheelchair and position it so it's close to their unaffected side, like the top left picture. From there, the patient can place their forearm on the seat, lean and push up to come to a tall kneeling position, like the top right picture. From there, the patient is going to push on the seat for support so they can bring their unaffected leg forward into a half kneel, and like the bottom left picture. The patient can then push with both upper and lower extremity while pivoting to get their bottom back in the chair. We also have a video to show of someone practicing this transfer.
Alright, so I will be talking about transfers for a lower extremity amputee. First, as we all know, there are various types of amputations in the lower extremity, but for this presentation I will be referring to the most common type, which would be a transtibial or below the knee amputee. Like previously mentioned by my classmates, this type of transfer can be done in various types of ways depending on the patient's specific abilities and needs. Assist level will also vary depending on what the mobility and level of function the patient has post-amputation. For this presentation, I will be showing a transtibial amputee who is far along in the rehab process and are fully independent in transfers. The general requirements for this transfer are sufficient core strength and overall strength in the sound limb and bilateral upper extremities. For this specific transfer, eccentric strength in the sound limb and bilateral upper extremities is important to ensure slow and controlled descent to the floor. Also needed is adequate range of motion in the trunk and sound limb to allow for proper body mechanics and mobility while performing the transfer. The following video will demonstrate a wheelchair to floor transfer where I will be narrating the directions of the transfer. In order to ensure safety, the patient must first apply the brakes on the wheelchair. Next, the patient will scoot forward towards the edge of the wheelchair and position themselves at a slight angle towards the residual limb side. Then, they will place their sound limb firmly on the floor and with the trailing hand, grab and hold onto the frame of the wheelchair. The patient will now flex their trunk forward and shift their body weight onto their sound limb. They will then reach for the floor with the leading hand. It is important to note that the patient must have a fully extended upper extremity while reaching for the floor to ensure proper stability during the transfer. Lastly, The patient will slowly lower themselves onto the floor using eccentric strength in the sound limb and upper extremity to control their descent. Okay, now I will go over how to get back into the wheelchair from the floor. Another point I wanted to mention was this transfer is being demonstrated with a unilateral below-the-knee amputee, but also know a bilateral below-the-knee amputee could still do a variation of this transfer depending on their level of trunk mobility and upper extremity strength. Since a below-the-knee amputee still has a knee joint, they can weight bear on the residual limb to support themselves during parts of the transfer. The general requirements for this transfer are again sufficient core strength and overall strength in the sound limb and bilateral upper extremities. As opposed to the previous transfer, the patient will have to have sufficient concentric strength in the sound limb to initiate the movement when standing up. Adequate range of motion in trunk and sound limb to allow for proper body mechanics and mobility while performing the transfer is needed as well. The following video will demonstrate this transfer. The patient will first assume a long-seated position and place their wheelchair on the sound limb side. At this point, the patient may apply the brakes if needed. After, with a fully extended elbow, they will place their hand on the floor towards the wheelchair. Then they will roll over towards the sound limb side, coming to a kneel in front of the wheelchair with both hands on the wheelchair for support. Next, the patient will flex their knee and hip in the sound limb and use the residual limb as support to push up and get into a half-kneeling position. Lastly, the patient will use their strength in the sound limb to completely stand up and pivot their body towards the residual limb side until the chair is behind them. They will then use the strength in their sound limb to control the descent into the wheelchair.
Prior to transfers for patients with paraplegia, they will be evaluated by the physical therapist to determine their current level of function and goals. These patients will generally maintain upper extremity range of motion and strength and will use a manual upright wheelchair. However, a patient who has more difficulties may use a push rim assisted power assist wheelchair. Push rim assisted power assist wheelchair. It combines the benefits of a manual and power wheelchair designed for patients who have some upper extremity weakness, joint degeneration, difficulty propelling manually, or decreased exercise capacity and/or endurance. Regardless of level, wheelchair training will begin on level ground and perform tasks towards goals of transfers, mobility in tight spaces, ramps, through doors, and other functional activities to maintain independence. One of the methods I found for paraplegic transfers from wheelchair to floor is called a floor sideways transfer. To perform this safely, you will be evaluated by your physical therapist to confirm abilities such as sufficient upper extremity strength and mobility, trunk flexibility to be able to bend forward, and general core strength for stability. First, you will want to instruct the patient to lock the brakes on their wheelchair, then steadily move towards the edge of the chair. If there is a cushion present, please remove the cushion so that the distance between the patient and the floor is decreased as much as possible. Then, turn sideways towards the right side of the wheelchair and grab the right chair frame with the right arm. After that, outstretch your left arm to reach for the floor. Use both arms to control your descent to the floor. Once you have landed safely on the ground, then clear distance between yourself and the wheelchair to avoid any collision.
Lock your wheel brakes and scoot to a front corner of your seat. You'll be getting out of your wheelchair at an angle, so set your feet on the floor off towards the side. Grasp the front of your frame with your trailing hand. Stabilize with your leading hand on your knee. Sliding the hand down your leg to the floor as you bend forward at the waist. While propping on your hands, slowly lower your hips from your seat diagonal to the floor. Pull a mat or your wheelchair cushion underneath you to protect your skin if you're spending time sitting on the ground.
In this slide, I will be covering how to transfer from the floor to wheelchair for paraplegics. There are various ways to accomplish this task when needing to return to wheelchair from floor, whether it be assisted or independent depending on the strength and mobility of the individual. However, for time's sake of the presentation, I will present one of the most common techniques in transferring from floor to wheelchair. General requirements that will be recommended to establish this is adequate upper extremity mobility and strength, sufficient core strength to stabilize trunk during transfer, sufficient flexibility in hamstring as indicated by the picture on the left. For the directions, remove the cushion from the seat of the wheelchair to decrease the distance from the floor to the wheelchair, and remove the side walls to eliminate any barriers. 2. Lock the wheels to ensure safety. 3. Position yourself perpendicular to the front of the wheelchair and with both knees bent, one arm on the wheelchair and the other on the floor. 4. Lean forward and extend both elbows while simultaneously using your core to swing your hips towards the seat of the chair. 5. To reposition yourself accordingly once your butt has reached the wheelchair. I will now present to you a video as directed by the instructions as previously described.
To get back into your wheelchair, pull it to your side so that your hip is against the front of your foot plate. Lock your brakes. Grasp the front of your wheelchair frame with your leading hand, placing your elbow on your chair seat. Tuck your feet close to your body, leaning your legs against the front of your wheelchair and pinning your knees with your chin. Position your trailing hand in a fist down by your hip on the floor. To swing your hips up to the wheelchair, lean forward and down toward your fist. Keep your shoulders down and vault diagonally up to the front of your wheelchair. Finish by repositioning your hips and feet on your chair.